To begin our description of cataract surgery, first an anatomy lesson is essential. If you follow the light beam on the left of our slide, the light beam initially passes through the cornea, through the pupillary opening in the iris, and eventually through the lens of the eye, eventually being focused on the retina. If we look at our next slide, the human visual system is very similar to that of a camera, in that the light is focused at the front part of the eye and gets focused on the back part called the retina, very similar to the lens of a camera and the film of a camera. A cataract is a condition where the lens of the eye becomes cloudy. Patients experience blurred vision as the light is scattered through a cloudy lens. Not all cataracts need surgery, however. Only through a detailed discussion with the patient's surgeon does a decision on cataract surgery need to be made. In this video, the incision is just being initiated with a very sharp metal blade at the edge of the cornea. The blade here enters the eye and creates a tunnel incision into the eye. After a circular opening has been made in the anterior capsule of the lens, an instrument is introduced through the tunnel that we had made. This instrument is basically an ultrasound probe, which has many ports, one for irrigation and one to vacuum up the remnants. This probe fragments the lens with ultrasound. This is the ultrasound probe before being placed into the eye. As you can see, it has many ports where fluid comes out. The probe is placed into the eye, and in this action, portions of the lens are being ground by ultrasound and being aspirated through the tip. Under higher power, you can see the ultrasound is cutting a central trough in the lens. This is one technique to fragment the lens into many pieces. In this segment, the lens had been subdivided into 4 separate quadrants. Here, one of the quadrants is being grasped and subdivided into 2 smaller pieces. The remainder of the lens fragments are then aspirated and emulsified or ground up through the tip. Small adherent lens fibers are vacuumed with a smaller vacuum device, leaving an empty capsular bag. Once the cataract has been removed, a lens implant will be placed into the eye to help focus. This type of a lens is foldable, in that it can be folded outside of the eye and pass through our small incision and eventually unfold inside the eye without enlarging our incision. Let's see this done in practice. Here the lens is grasped, eventually folded, and placed in through our incision into the eye, unfolded, and eventually placed into a perfect position into the remaining capsular bag or the outside casing of the lens that is left. Here the eye is reinflated with fluid and the procedure is complete.